Hello YouTubers! York and I here would like to welcome you back to our channel. In this segment we'll go through the remaining cervical vertebrae, C3 to 7. But before we begin, I'd actually like to thank you all for the support from last time. It's truly awesome that there are so many people interested in anatomy, and I'm excited to see how far this thing will go. Let's see if I can turn everybody into a proper anatomy nerd. Anyways, let's get started. Here you see the remaining cervical vertebrae. These span from the typical C3 to 6, ending with the atypical C7. If you look at C3 to 6, you'll notice that all of them are pretty much the same, only with slight variations in structure and size. This is essentially why we call them typical cervical vertebra. I will use the C5, 3, 4, 5, there we go, to show you the different landmarks of a typical cervical vertebra. If we start anteriorly, there, we can see the vertebral body, this big structure here. This is the vertebral body, which has uncinate processes on the superior side of it. Continuing, if we move towards the lateral parts, we can see the transverse processes, these two parts, which have an anterior and a posterior tubercle. So this part is the anterior and this part is the posterior. And also on this side we have the anterior and the posterior. See, I can zoom it in a bit. There we go. And of course, like last time, there are the foramen. We have 2 transverse and 1 vertebral. Let's see if you can find it, because I can. Remember last time we discussed that a foramen is basically a freaking hole. So, the vertebral foramen and the 2 transverse ones. Let's not forget the articular facets. We have 4 in this segment that we're going to discuss, which are the 2 superior facets and the 2 inferior facets. These will be in articulation with the next vertebra in line. And lastly, you can see a nice bifid spinous process. Of course, bifid, like we said last time, means that it's bifurcated. And the spinous process is this segment here. On today's side note, I'd like to explain the word uncinate. Which are these parts, the uncinate processes. Uncinate means something having a hooked shape. If we look closer, sorry, I'm not used to camera angling. There we go. There. Let's zoom in. There. You can see the sharp ends that I pointed to. I'm guessing that the anatomy scholars of ancient Greece thought it looked like a hook. I'm not sure, but in any case, uncinate means hooked shape, which is what they are guessing the structure be like. Also, I thought a little fun fact, the anterior tubercle on the C6 is commonly called the carotid tubercle. It's anatomically where the carotid artery separates from the vertebral artery and where the carotid artery may be compressed by the finger. Now moving on, last but not least, we have the atypical C7. Here I feel we can be rather quick and direct. There is the C7. We have, let's zoom in once more, there. We have the vertebral body, the transverse processes, the facets on the inferior side as well, the spinous process, and the foramina, vertebral and transverse. Pay particular attention to its long non-bifid spinous process. Most often the longest process of all the cervical vertebrae. It's so long that it made the C7 earn its own name in Latin, which is the vertebra prominens. Fun fact, if you look at the base of a person's neck, you can see a small bump. This would usually be the C7 because of its massive structure. Also notice how small the transverse foramina are. This is basically something that's just not exactly the most important part. In some structures there aren't even there on a person. It mainly has just a few accessory veins passing through them. Furthermore, I'd like you to understand that all these processes and tubercles are usually an attachment site for muscles and ligaments, etc. But we'll get to that once I finish the skeletal anatomy. Now, shall we build Yorick's neck? Here's what the cervical segment of the spine will look like once they're properly stacked up. Movie magic. Anyways, this is how a cervical vertebra looks like when it's stacked up. Pretty cool, huh? Notice that if a neck, the cervical vertebra, is hyperextended, such as in this angle, it's called lordosis. And if it's hyperflexion, let's see if I can push it the right way. There we go. It's kyphosis. So lordosis, kyphosis. But try to realize that this is just a simple model and it's not the easiest one to manipulate around. So shall we start from top to bottom? C1, atlas, as you remember. C2, axis. The typical one, 3, 4, 5, and 6. And the last one, the vertebra prominens. Beautiful. Anyways, boom, great. We are done with Yorick's cervical vertebra. Doesn't he look happy? Sorry guys. Hope you enjoyed my second video. Feel free to press, like and blah, 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 blah. More importantly, any profit will be donated to scientific research and humanitarian organizations. So, Doc signing out. Peace.